I'm assuming primary care physicians is mostly who you're speaking with?
It can be a primary care physician, OBGYN, a urologist, or just chiropractors.
Yeah.
Anyone that's lacking in this kind of information. And I do it for the people,
Sure.
like there's a lack of knowledge out there and we just want to spread the word.
Jenny Chavez is a doctor of physical therapy and the founder of Route to Recovery. She graduated from the University of the Incarnate Word in San Antonio in 2015 and has been an avid soccer player her entire life. Unfortunately, she suffered an ACL tear in 2007 that would end her competitive career. It was this incident, though, that would get her a taste of physical therapy. After spending several years in the corporate world and dealing with copays, deductibles, out-of-pocket fees, and denied insurance authorizations, Dr. Chavez decided to take things into her own hands with Route to Recovery. She is here today to share her deep knowledge of the pelvic floor, why conditions related to the pelvic floor go undiagnosed, as well as why insurance may not always be your best bet when it comes to certain conditions. Welcome to Only the Greatest Podcast. If you're feeling stuck and unsure what to do next in your fitness journey, we might be what you're looking for. My name is Philip. I own and operate OTG Fitness, which is a private personal training gym on the south side of Houston in Webster. I do this podcast every week with my best friend, Daryl. We've been friends since third grade and working out together ever since. Also joining us today will be Sean. He's the one that makes this podcast not only sound great, but look good as well. Our goal here is to help Houston make its way up the ladder of health and fitness. So if you're in the Houston area and ready to become the greatest version of yourself, be sure to like and subscribe on your favorite podcast platform. I know you said Jenny, but I like Dr. Chavez better. Yeah.
All right.
So
we can go with that.
Yeah. Do you usually go in the clinic? Do you go by Jenny or doctor or like what do you?
They'll call me Jenny, Dr.
Okay.
Chavez. It varies. That's why when
Yeah.
you ask me, I'm like, whatever you feel comfortable with.
I like Dr. Chavez, but you look like a Jenny. So
that's why I go by both because I can
kind of
play both roles. Yeah.
Yeah. So I don't know if you noticed, but my name is spelled kind of weird. So like my entire life, people call me different things.
Yes.
And actually, my first name's not even Philip at all. So I don't tell anybody. But
even right now, I was looking at for your name, and I did just one L, and you didn't come up. So I was like, it's missing something.
There's two L's. So my name is a mixture of English and Spanish.
Okay.
So it's like I've actually never met my dad, but the person that gave birth, obviously my mom gave birth to me, but the father in my life, or the father that gave me life,
yes,
his name is Felipe.
Okay.
And then
with an F.
With an F, like Felipe, right? Hispanic Felipe. So my name is a mixture of English Philip, like Philip, and that. And why there's two L's, I still don't know.
Interesting.
But it's
like it. It's unique.
It's a combination of those two things. But welcome.
Thank you. Thank you for having me.
To the pod. Yeah, guys, this is Jenny, or Dr. Chavez. And today we have some really valuable information about the pelvic floor. I got introduced to you by Dr. Brackney.
Yes.
And he's a really good friend of mine. How long have you known Dr. B?
I met him this year.
Oh, wow. Okay.
Yes.
Yeah.
A couple of months.
Okay. Yeah. I've known Dr. B for a few years now, and I always tell everybody, like, he's taught me so much about, like, the human body. And I always say, I have this really good friend. He's actually the most knowledgeable person about the human body that I've ever met. And that's, like, how I introduce Dr. B to people.
He's actually very knowledgeable. So we met up in person, and because he's a chiropractor and I'm a physical therapist, a lot of times people get us confused as, they call me a chiropractor, or they'll call him a therapist.
Okay.
But what we wanted to do is see how the approach that we both take. And we realized that it's almost a very similar approach, but because we look at the whole body, some therapists may not do that, some chiropractors may not do that. But for us, we clicked in that sense that you come in for back pain, we're going to look at your whole body and analyze everything. And so we clicked in that sense. We both have our own different techniques, but we were able to teach each other.
Yeah, and actually, Dr. B is one of the first people that taught me that an ailment in one area of your body does not necessarily, and obviously I've known that for a long time, but he put it in a different perspective to me, that an ailment in one part of your body doesn't necessarily mean that that's the reason you have that issue, right?
And that's awesome, because you're not the first person to say that. Everyone that knows him or of him, they say, he taught me that. And I'm like, yes.
Yeah, exactly.
Because we want to make a lot of people aware of that, you know?
Yeah, it's super important. And I even, in the gym, obviously as personal trainers, we try to discuss that with people as well. Now, while we don't resolve injuries, we do work around injuries, right? And so that being said, that you said something interesting, how he's a chiropractor and you're a physical therapist. Yes. So before we get into what we're going to talk about, which is mostly the pelvic floor thing, which I thought was super interesting, and we decided to kind of dive in on that, why don't you just tell me or tell everyone listening, what is the difference between seeing you as a physical therapist or just a physical therapist in general, like even if they're not local to exactly, in your, neighborhood or whatever, if they're, what is the difference between a chiropractor and a physical therapist, or why would someone see you versus a chiropractor, or a chiropractor instead of you, vice versa?
Yeah. I wish that was an easy answer to that question, but I think it depends on the chiro and the PT. You know, everyone's different. And so my style of PT is very different from another PT. For example, like I said, Dr. Bragney, he's not your typical chiropractor that you're just going to go in and get adjusted. He has an evaluation process, and he looks at your whole body. And so in that sense, it's just going to come down to personality or who the client feels more comfortable with.
I think that's a really great point, because it's the same thing in personal trainer, and a philosophy that we have at OTG is it's personal before trainer.
Yeah.
So obviously we are professional trainers and all that kind of good stuff. But at the end of the day, like, personal training knowledge is personal training knowledge, right?
Yes.
So it's really the relationship and the personal side of things is almost more important than anything else.
Exactly. Because, I can sit here and say, well, physical therapy, that we show you techniques for the long run. You hear that a lot. Chiropractors is going to go in and adjust you. But I try to stay away from that because I don't know how everybody treats. When I met Dr. Brackney, I was impressed.
Yeah.
I was like, wow, you do it differently. You're not just going to lay someone on the table, try to pop their back, and then them think that the problem is solved. You're actually going to show them exercises and educate them on things that they can do to continue to get better.
Yeah, and that's one of the reasons I clicked with him as well, is because it is just so much different. But anyways, I was just kind of curious of that myself.
Yeah, I don't know if I answered your question.
Yeah, no, 100%. I think that it makes total sense. And it for sure, the personality of the person is very important. So if you're listening to this and you're not in a good, relationship with your practitioner of any type, whether it's in the medical side, physical therapy side, chiropractic side, personal trainer side, and you feel like you can't be open with that person, you're not getting the best care that you could. Yeah. It is very important that no matter what service that you're taking advantage of, that you get along with the person, you feel like you can be open, honest, and tell them what's really going on, because otherwise they're not going to be able to treat you to their best abilities.
I agree. Because any problem is going to take more than one visit.
Sure.
So if they don't like you, if they don't click with you, if there's no connection happening, they're not going to come back. And then their problem is still going to be there.
For sure. 100%. Same thing in personal training. So, all right, well, let's go ahead and move on to the kind of the bulk of what we're going to be talking about today, which is pelvic floor. And when Dr. B first introduced me to you, he mentioned that, and I was very curious myself. And I was like, and I even told Sean, I was like, hey, Sean, we got to get her on the pod so we can learn together, and hopefully people listening can learn something too. So we have a few things that we're going to go over. So what we're going to talk about first is what is the pelvic floor, right? And then we're going to go into dysfunctions of the pelvic floor, why it happens. We're also going to talk about what it looks like specifically in men versus women. And then we're going to also discuss why it goes undiagnosed, because that's something that you, because I told you that I have heard of this, but I've never actually met anyone with it. But then you corrected me and said, well, maybe you have, and they just don't know. Yes. So we're going to talk about that. And then the last thing that we're going to cover, which I thought was very interesting as well, is if you do need care like this, or any care, why insurance may not be your best option, even if you do have it. This is something that Jenny has a deep knowledge of, so she's going to share a little bit about that with us as well. So why don't we just start from the top? Tell us, what is the pelvic floor? What does it do on our body? How does it work? Stuff like
So
that.
let me ask you this. When you heard pelvic floor, what did you think?
Oh man, putting me on the spot. When I hear pelvic floor, like obviously in the fitness world, we talk about like core stability a lot. And when I think pelvic floor, that's the first thing that I think of. And to be transparent with everyone listening too, and even you, my formal education is actually in business management. Not in health and fitness, but I've been doing this a long time. You know, I have a deep passion for it, but my formal education, my degree is not in health and fitness.
And
but
that's okay.
From the, experience that I do have, certifications that I do have, that's what I think of when it comes to pelvic floor. The support of our abdominals helps us breathe, the diaphragm and things like that. So let me know if I'm in the right direction, if I'm in the wrong direction.
You are completely in the right direction.
Okay, cool.
So yeah, basically the pelvic floor is a group of muscles in your pelvis. They sit at the bottom like a hammock. And what they do is they support the organs. So they support the uterus, the rectum, and your bladder. So they support those three organs so that they're not falling through, right? So when you hear prolapse, that's one of the symptoms from a pelvic floor dysfunction.
Prolapse?
Prolapse.
What is that?
So you'll hear uterine prolapse. That's when the woman's uterus has dropped. And so the woman may feel pressure in between her legs in that area, or they may feel discomfort.
Oh, and what would cause that?
So usually it comes with age, and especially for women who have had children, those muscles tend to get weak. And so with time, those muscles, it's like a hammock, right? That hammock stretches out and stretches out, sort of like the abdominals, right? You stop losing the strength, you start, your belly starts to sag. So same thing in the pelvic floor, those muscles start to sag a little bit, and then here goes your bladder. It can prolapse. It can literally go through the vaginal canal, or it can also be the rectum or the so it was the bladder, the rectum, or the I forgot the other organ.
Yeah, that's okay. Yeah.
But they can prolapse.
Wow.
So that's basically what prolapse is. So what causes it is there can be a weakness or a lack of flexibility in those muscles. And the lack of flexibility can come from tension. You know how we have tension in our shoulders, we hold tension in our necks, and then we start to build knots in those areas. Well, then you start to build knots down there as well, to the point where it can cause pain, tension, or even eventually cause the prolapse to happen.
Yeah, and I'm sure that we'll here in a few minutes we're eventually going to get to how we actually treat it. We're going to talk about that. But you mentioned that it happens with age. Do you know, maybe you don't, what percentage of people, and we're specifically talking about women right now, right? Women get it more often than men. Is that correct?
Only because they report it more often.
Oh, okay.
This is a very personal issue that some people just don't bring it up.
Okay.
And so I don't know the numbers for that, but yes, it's more common in women because they will feel more comfortable bringing it up to their doctors.
Okay.
To their OBGYN when they go for their woman's exam. And men don't really do that for the most part.
Do you know what percentage of women or people in general, due to age, go through an issue like this?
No, I'm not sure about the number. Again, it can happen with age, but at the same time, it can also happen to younger women.
Okay.
So women that haven't even bear children just yet, just the fact that they're not strong in their core, like you mentioned earlier, the fact that there's weaknesses there, it can cause pelvic floor issues.
Oh, wow. And you mentioned the prolapse where the organs actually fall through.
There's different grades for that.
Okay, that's what I was going to get. I wanted to go a little bit deeper, and then I also wanted to ask if there's any other. So why don't we talk about the different grades that you mentioned, and then let's also talk about maybe any other issues that can actually come across.
Specifically, there's it's by inches or centimeters. So I don't remember all of that, it's just the different grades depending on how protruded the organs are.
Wow. So we're basically what I'm envisioning, and correct me if I'm wrong, is, and if you're watching on YouTube, which you should be, but I'm seeing your body obviously is vertical.
Yes.
So I'm imagining perpendicular to that is the floor, right? Yes. Underneath your stomach.
Yes.
It's a sack, like you mentioned, almost like a hammock. And if I I'm interlacing my fingers, and if I spread my fingers out, I now create these gaps. And so what you're saying is that my organs could fall through those gaps. Is that correct?
Yes.
Wow.
Yeah. So you have your bladder in the front for men and women. Then you have the uterus for women, prostate in men. And then in the back, you have the rectum. So some women, they don't have the uterus anymore. They have a hysterectomy. So then they have the bladder and the rectum, and there's nothing holding them in between. The uterus is gone. So now the uterus is gone, and due to a lack of core strengthening, stabilization, now those muscles are no longer supporting those two organs anymore. The pelvic floor is weak, and so now they can prolapse through the vaginal canal.
Wow. And you mentioned prolapse a few times now. Is there any other things that can happen?
Yes.
Like what?
So aside from prolapse, you can have pain with intercourse.
Okay.
Again, that goes back to the tension in those muscles. It can also be caused from trauma. You know, if a woman experienced any kind of trauma as a young girl, those muscles can be tensed up and they won't relax for anything. So then they get to adulthood and they realize they have pain with intercourse. The big issue with this is that they'll go to their medical provider, their OBGYN or their PCP, and they don't know much about the pelvic floor. So the provider, yeah. They don't learn about this in medical school. I don't know if they do now, but they didn't used to. And so our job as PTs is to go out into the doctor's offices and educate them on these topics that we're going over right now.
Wow. So you do that now?
Yes.
Wow.
So that they know that these men and women can get help from us.
Okay. So let's say right now, someone goes to the doctor and they mention that these things are happening. What are the doctors oftentimes, what are they thinking that the problem is? Do you know?
Yeah. So sometimes they'll say that it's a UTI.
Okay.
And so they'll go that route. Believe it or not, some doctors say, oh, well, drink some wine, relax when you're having intercourse. And women they do that because they think, well, the doctor told me to just relax, that I'm just tensing up maybe. So they don't really know what route. They don't really know how to educate their clients. And so one of my goals is to create a brochure for doctors to be able to hand out to their patients. And so, just to have the general information, like what are your symptoms, what may it be, and how to reach a pelvic floor therapist.
Wow. And how often are you going out right now and doing that? I know that you have your route to recovery thing that you're doing now. Is going and talking to the doctors. I know this is a little bit off topic, but I'm just curious. Is that part of routes to recovery? Yes. Or is that something that you do independent of that?
That's part of route to recovery.
Okay. So you see patients individually as well as educate. I'm assuming primary care physicians is mostly who you're speaking with?
It can be a primary care physician, a OBGYN, a urologist, so just chiropractors. Yeah. Anyone that's lacking in this kind of information. And I do it for the people,
Sure.
Like there's a lack of knowledge out there and we just want to spread the word.
Yeah. And this is not, how did you get into this specifically? Because I remember, and once again, I know this is off topic, but I'm very curious myself. How did you get into this? Is this something you went through yourself or?
The pelvic floor?
Yes.
It's not something that I went through, but I started seeing it a lot with patients.
Okay.
They were coming in for back pain. And there were patients that I could get, help get better in 6 to 8 weeks. But then there were those that I couldn't. And I was like, something's going on here. Something's going on. Aside from back pain, they started mentioning incontinence, pain with intercourse, prolapse. And so I was like, there has to be something else that I'm not seeing or that I don't know about. And so I started doing research and I took a course on pelvic floor. And that's how I started getting into it.
Wow.
But I had to go through the treatment myself when I took the course. So it was me and another therapist doing the treatments and evaluating each other.
Okay. All right. I was just very curious about that myself. I don't know why I didn't think of that question earlier, but anyways, to get back on track a little bit here, I'm imagining this hammock looking situation. And we said that prolapse is when there is a gap and the organs fall through. But you also mentioned that the pelvic floor can be too tight.
Yes.
So I'm thinking that's the opposite of prolapse. Am I right about that or am I? What's going on
Okay,
here?
so with most conditions, right, that you're on the right track,
Okay.
right? Because that's what we all think. If it's too loose, it's gonna hang. If
Yep.
it's too tight, it's gonna hurt. But most women, they have a combination of both. There's tightness and weakness, and so that's where we come in, because we're able to determine if it's both. Most of the time, it is both, and so then we have to create a plan. First, we want to lengthen the tissue, and then we want to strengthen it after that so that they can have this long-term stability.
Wow. Okay. So how big are we talking? If you're a bigger person, is your pelvic floor bigger, and you're a smaller person, it's smaller? Is that how this works?
Yeah, I mean, just like with any other muscle, they work just like any other muscle.
Okay. And so I'm imagining roughly maybe, I don't know, I'm thinking about myself here, maybe 12 inches wide by like 8 inches long. I don't know, you know? And so some areas of this.
Trying to get the floor plan of this
I
whole
should have
thing.
brought my.
Yeah, I mean,
I
I'm
should
just
have brought my model.
Oh, you should have.
I should
Yes. Yeah, that's okay. But so I'm imagining this thing. I keep using, if you're watching, I keep using my hands.
Yeah, so
because
the
that seems
muscles
to
are
be
not
helpful.
the muscles are like the size of your finger, and there's 3 layers. So there's an inner layer of your pelvis.
Mhm.
Have you seen a model,
Yes.
pelvis model?
Yes.
Well, inside there's one layer, and then right underneath it is another layer, and then at the bottom it's the 3rd layer.
Okay. And each layer, and so vertically through the layers and horizontally, like surface area wise, we can have tightness or looseness, for lack of a better term, in different areas of this hammock.
Yes, and there's different muscles, different nerves come through those muscles. And so you asked me about men, right? So the most common thing in men that I have seen is pudendal neuralgia, like a nerve issue. And that's usually common with men who ride a lot of bikes. They cycle a lot. And so their position is forward, and then their weight is sitting on their buttocks the whole time, right? And so they're riding for hours and nothing's happening. But with time, they'll start to have pain in their groin area, their penis area, their like just in their private area. They go to the doctor again. Doctors don't know what's going on. And so if a doctor is aware of it, they'll be referred to a pelvic floor therapist.
Oh, wow. So if they know it, then they can go get the treatment.
Yeah. So more than
that's
likely,
necessary.
there's a muscle that's tensing up and hitting that nerve that projects the sensory to the male parts.
Okay. So speaking of men and women, the symptoms that people are getting, are they going to be different in men versus women? I know you said pain during intercourse and just pain in their groin area in general. Is there any symptoms specifically to men or specifically to women, or just anything out of this category someone could be suffering from this pelvic floor dysfunction?
I think the main difference that I can remember is for men, they can have pain with erection.
Okay.
Versus a woman, they're going to feel pain even sometimes with you touching them on the outside. But there's also pain with penetration, and it can be deep or not as deep.
Okay.
Yeah.
Another one that we haven't mentioned that in my personal research, trying to get ready for this and learning a little bit more to make sure that I'm asking solid questions, was leakage.
Yes.
Can we talk about that real quick? And that might even lead a little bit into like the why it goes undiagnosed thing, maybe a little bit of embarrassment, and we can talk about that as well. But why don't we talk about the physical piece of it, and then we can talk about the mental and emotional piece, maybe separate from that.
So I actually forgot to mention leakage, but that's the most common one, I would say.
Okay.
Leakage, especially with athletes, that happens a lot. And constipation. I forgot to mention constipation.
Okay. Why in athletes for the leakage thing?
Because they're doing heavy lifting.
Okay.
And they're not coordinating their breathing with the lift. And so as they try to push heavy weight, they tend to hold their breath. And when they do that, they're pushing down on the pelvic floor. Because another thing that we haven't mentioned is how the diaphragm connects with all of that.
Oh, yeah. Tell us about that.
Yeah. So with the diaphragm, if you're controlling your breathing, the diaphragm is going to move smoothly with the pelvic floor, and it's going to, you breathe in, pelvic floor opens up, you breathe out, pelvic floor comes back in. So if you think about heavy lifting, and like I said, sometimes people hold their breath, they're, what do you call that? The Valsalva maneuver? Where
Yeah, the Valsalva, yes.
They're just applying pressure. Then the pelvic floor is just tensing up the whole time, tensing up, tensing up, tensing up. And with repetitive tension, then you start to get symptoms of leakage. Why? Because the bladder is now compressed and it's not getting the space that it needs in order to properly function.
So as with anything, the harder you push it, the more likely a problem could arise.
Yes.
So athletes are constantly, and if you're not familiar with the Valsalva maneuver, that is basically, it's what you, like when you got to go to the bathroom, you do the Valsalva, but also we talk a lot about in lifting weights. Like if you say you're doing a deadlift or a heavy squat or even a bench press, something like that, for example, with heavy weights in your hand, you kind of breathe in, hold it, and you brace through the midsection, brace the muscles through the core, as we say, right? Which is, and then you try to push that heavy weight. Well, that what you're saying is that's putting so much strain that it's going to help, or not necessarily help is not the right word, but it's going to bring to life any of these issues. Like if you have maybe you have borderline dysfunction, but a year or two of doing this, it's going to come to fruition eventually.
Yeah. Like let's say a 20-year-old, right? She was in CrossFit in high school. She was in CrossFit in college, but then she got pregnant. She went through the pregnancy for 9 months. And then, 3 months later, she's like, I want to go back to CrossFit. But then there's no training up to that again. So from the pregnancy, her muscles are weak because there's no training. There's some therapists that are starting to do like birth prep classes and things like that to strengthen the pelvic floor. But for the most part, most women are not getting that. So then this person goes back to CrossFit and starts doing this heavy lifting again like she used to, because it's only been, a year that she's been out of it. And so she's overstressing her pelvic floor, overstressing it and not knowing it. And then all of a sudden she coughs, sneezes, or laughs, and then she leaks a little bit of pee. She doesn't think anything of it, but then it happens again and again. And now she's leaking more. And she's like, well, what is happening? And so instead of reaching out for help, they'll just stop going to CrossFit or to the gym, and no one will ever know.
I actually have a question about that. So I've seen a few videos of powerlifting women that have experienced peeing on the deadlift platform. Yes. And it's kind of like, it's not really a joke, but it's like kind of taken as that. It's like, whoa, look at that. Is that possibly due to weakness in the pelvic floor?
That's exactly what it is.
That's like undiagnosed? Really?
You'll see a lot of videos on YouTube about that.
Oh, see, I didn't know that.
Yeah, is that something that they can fix themselves through? Maybe we can kind of transition a little bit. We've talked a lot about the problems that it can cause, the symptoms, the maybe even the emotional situation when something like that goes on. And I never really, you just said it and really kind of hit me in the face with it, to be honest. Someone goes through this embarrassing time, and instead of doing something proactive about it, they just stop doing the thing that is causing it, which is something that maybe they enjoy, something obviously that's good for their health. Which is very unfortunate. So I hope that, we can bring some of this information to light and let people know that that's okay. Yeah. Even like the situation that Sean's talking about. Hey, it is what it is. Instead of stopping, why don't we try to do something about it and get it done, fixed professionally and things like that. So why don't we talk a little bit about what people can do on their own, to kind of fix this issue. And then obviously if they can't fix it on their own, then they could come see someone like yourself,
For sure.
A licensed professional. But what can they do themselves if they're experiencing some of these symptoms?
So first of all, don't do Kegels.
Okay.
That used to be, the number one thing.
Yeah, I'm familiar with Kegels.
What are Kegels.
What are Kegels?
Kegels is when you're basically practicing to lift your bladder. It's basically working the pelvic floor to raise your bladder so that you don't have pelvic floor dysfunction. And so a lot of after giving birth, a lot of women are given a brochure with Kegels to do at home to strengthen their muscles. But that was what they used to think back then. Do Kegels and it will solve your problem.
Okay.
So for people that are trying to prevent this from happening or to help themselves at home, I would say if, work on your breathing. Relaxation techniques are key because, like we mentioned, a lot of stress can cause tension, not just in your back, shoulders, and neck. It can also cause tension in your pelvic floor muscles. So relax, find things to do, go to yoga. Try those things first. There's resources. I've created a couple of exercises for people as well to try on their own to relax some of the muscles. So different poses for them to do.
Where can they find those?
I have it on I'm going to put it on my website.
Okay,
but
perfect.
I don't have it out yet.
That's okay. Yeah,
Yes.
that's okay. Okay.
And I can also send it to them directly through email.
Okay.
If they ask me for it. But that's the main thing. So try to relax, stay active, stay strong, because the pelvic floor is not just a problem in the pelvis. It's a problem in your whole body that you may not realize. The problem may be coming from your foot, your ankle. It can be coming from your knee, your hip, your core, like you mentioned. Breathing. A lot of times we don't breathe. We think we're breathing, but we're not really breathing.
What do you mean by that? Because you said work on your breathing, and now you said
mention it again.
Yeah, mentioned it again. So, what does it mean to breathe bad? I guess
So when you breathe, when you're sitting and you're actually practicing breathing, you want to make sure that your rib cage expands, your abdomen expands as well. That means that you're actually taking a deep breath, filling your muscles and everything with oxygen. Sometimes we just sit there and we're just like, we're not
short breaths.
really short breaths throughout the day. Or sometimes we don't even breathe. Like we're just doing things. We're not mindful of it and we hold our breath. And so I didn't used to pay a lot of attention to this, but now I do. And so a lot of people, they're just holding their breath.
That's definitely something that in the gym we constantly are talking to people about, is breathing while exercising.
Yes.
It sounds so weird to forget to breathe, but what happens, at least in the gym, what I've seen in my experience as a personal trainer, what happens in the gym is people are so focused on this new thing that they have no clue how to do it. Like we put weights in their hands and like, what do I do with these? They're so focused on doing the exercise right that breathing just gets skipped over.
That's
and
what
they
I mean.
forget to do it because they're so focused on the exercise.
I had a client that had neck pain. I would say it was severe because this person was they just wanted to be in bed. They didn't want to do anything. And I was like, let me evaluate and see what's going on, because this is weird. You're an active person. So I go and I do the evaluation at their home, and they're showing me their form. Their form is good, but they're like this, like just holding their breath, like tensing, clenching their teeth the whole time. So that caused a lot of tension in the muscles, not just there, but in the pelvic floor as well.
Wow.
Luckily, they didn't have pelvic floor symptoms, but all of that was caused from not breathing properly.
Yeah, and probably during exercise is the most important time.
Yes.
That's the most important time to breathe. So that's crazy. Well, great stuff there. We talked about the pelvic floor, what it is, what dysfunction looks like. We talked a little bit about it, what it looks like in men and women both, like maybe a little bit of the differences and similarities. And then obviously why it goes undiagnosed with the emotional side of things. And, some people even let it interfere with what they want to do and their plans and things like that. So let's talk about someone that now knows that they have an issue. They tried these things at home. They watched your videos or whatever, and they're like, man, this problem just continues. And they want to do something about it. You enlightened me a little bit about the insurance thing, and you sounded very passionate about it. So I was very curious. I've dealt with medical insurance as someone that was formerly employed and now self-employed. As you could imagine, the insurance whole thing, I've been through it all, right? So why don't you educate me as well as anyone listening about if they want to get care specifically for this, and even just in general, if you want to go with that, that's fine with me. But obviously we're talking here specifically pelvic floor, but let's talk about why insurance may not be the best option, even if someone does have insurance. And I'll let you kind of lead the way here, and I'll probably have some questions along the way.
Okay. Yeah. So the first question that I get, let's say you were coming in and you had pelvic floor issues. Then the next question is, do you take my insurance? And I just smile now, right? Because I'm used to it. But I try to direct people to tell me more about their problem. And I'm not doing this in a bad way, because I don't want to take their insurance or anything like that. But I really want to get to know the person. And so what a lot of people don't understand is that when I take insurance, I can't get to know them like I want to get to know them, right? The insurance wants to see codes, wants to see specific documentation being done, and only certain treatments are covered by the insurance, where the patient is not going to get treated as a whole the way that I want to, because I have to do all of these things to satisfy what the insurance wants. And then sometimes even I do everything and they still get denied. And so what I tell people is, let's talk more. Tell me more about your problem. I want to get to know you as a patient, what you're suffering with, and then I can tell you how I can help you, and then we can talk about your insurance. So if the person does have insurance and they really want to use it, then I provide them with a super bill. And the super bill, it has all of the patient's information, my information, the treatments that we did, and basically the patient submits that to the insurance directly, versus me having to do that work. Because as a therapist, I want to be able to focus on my patients and not having to deal with insurance denials and things like that.
So I guess kind of what I'm hearing is that even if someone does use insurance and you can fix their problem, there's like an invisible hand that's going to be guiding what you do with that patient. Is that correct?
Yes.
And you're not going to be able to do all the things that you actually want to do
exactly
with that patient.
Yeah, I worked in corporate world for years, and the amount of denials we got was crazy.
Do you think it's because, and this is just me asking, do you think it's because the issues that we're talking about oftentimes with physical therapy are not like life and death issues?
Probably.
Do you think that's why?
Probably, but I think the other limitation is that the people behind insurance companies are not physical therapists. And so that's what's frustrating to us, that how are you going to, and I don't mean this in a demeaning way, but how are you going to tell a therapist what's appropriate for their plan of care and what's not? You know, sometimes I'm working with a patient and then the front desk is like, "Hey, Jenny, the insurance is on the phone for you for a client." So then I have to spend time away from that patient to be on the phone over here trying to convince that insurance that the patient needs authorization. But all of that has already been put on the paperwork. So I'm just repeating myself over and over again to these insurance companies. And I don't mind it because I do it for the patient.
Right.
But I found this cash-based world and I'm loving it. And I just want people to know that there's help out there for you. And if you have insurance, you could still use it.
Yeah, you can use it.
You can use it, but they do the work, with the insurance.
Yeah, sure. And is there a situation where if you had a client, I keep saying client, like we use the word client, but for you, patient, you have a patient in front of you and you have a plan of action that you want to follow. You need insurance approval. Is there times where you now change your plan of action because of an insurance situation compared to what you would have done in the first place?
Before I had to. Now I don't.
Okay, why?
Well, before when I worked in the corporate world, I had to.
Okay.
Now I don't. So now I'm free to do my recommendation for the patient.
Okay.
Just give it to them and follow it.
Yeah.
And I don't have to worry about that.
And the insurance will still get taken care of if they want to do the super bill situation?
It should,
okay.
But it just depends. Every insurance is different. They have different plans. And then a lot of times, the patient may have a deductible to meet or a copay, and so that's a whole different thing that they have to deal with.
Yeah, you mentioned something else to me that I thought was pretty interesting the other day, which is in a lot of insurance-based clinics, they have staff, I guess, that is specifically for that, and they're not necessarily maybe as concerned about or specialized in the actual issues of the patient. Can you talk about that for a minute?
Yeah, so the reason why clinics or hospitals use insurance is because the insurance reimbursement rate is very low. And so in order to get the reimbursement that they need in order to move the business forward, they have to see at least 2 to 3 patients in 1 hour. That's the only reason. And in that hour, you may see the doctor of physical therapy, or you may see a technician or a student. So it's a big difference. Over here in a cash-based world, you're going to see the doctor of physical therapy at every visit. You see?
Yeah. Okay. Yeah. And I asked my question kind of wrong, but I'm glad you picked up. You picked up on what I was getting at, even though I asked you the question wrong. So what you're saying is sometimes people go to the doctor and don't see the doctor, basically, during their visit, because they are required by the insurance company to see 3 people per hour. Right. And the doctor can't get to all 3 people per hour.
Yeah. And it's not required by the insurance company, but just because it's based on their reimbursement rate, the hospitals have to see that many people in 1 hour in order to get their money's worth.
I got you. Okay.
So then they have the doctor of physical therapy bringing in new patients, doing evaluations, while the assistants and the technicians take care of the follow-up visits.
Got it. Okay, cool. I mean, that makes a lot of sense to me. I mean, when you told me the other day, we were kind of talking about this, kind of putting together how we were going to, the things we were going to talk about. A lot of it made really good sense. And I was like, oh man, I never thought about that way. Cause I know other people that are cash based as well. And they always talk about how better it is, but I've never really gotten into deep conversation.
Yeah. And then another thing is you go and you use your insurance, right? Because you have a $50 copay, which is a lot less than what you would be paying in a cash based clinic.
Right.
That's what it seems like, right? But then you go through your plan of care, and then weeks later, you get all these bills in the mail, like $200 and then $300, and then you're like, I thought I paid my copay. Yeah, but there's hidden fees and things, and we don't have any hidden fees. It's just an upfront fee.
That's definitely what has happened to me before as well in an insurance situation. And actually, believe it or not, on this note, Dr. Brackney was the first person I ever met, I think, that discussed with me that he's cash based, because we were starting talking about how we can help each other with our business and clients and stuff. And he was like, hey, I want you to know, make sure that, I'm happy. I'll talk with the patients about it as well. And I'll talk with your clients about it, but we're cash based. And he kind of explained to me what that meant. But once again, we didn't get into as deep of conversation as you and I are talking about, because when someone sees you or sees Dr. B, it's a full 60 minutes usually, is that?
Usually 60
kind of how the appointments go. So yeah, it's a full 60 minutes of just one-on-one with the doctor.
Yes.
Right. And why don't you tell us real quick, like what that 60 minutes may look like in a situation? Let's say someone has these, maybe they had a little bit of leakage. They are having some pain during intercourse, like we were saying. They come to see you. Like what does that process look like? How long does it usually take to get these issues fixed?
So for pelvic floor issues, it can take anywhere from 6 to 12 weeks, depending on the severity of the situation, and also the patient's prior level of function, right? So if they were pretty active before and then they started having these symptoms, well, it's not going to be that hard, right? Because the muscle memory is already there. And so we just have to train them again to use those muscles. So when a person comes in for an evaluation, we sit like this. They're sitting in front of me. I'm taking notes, but my attention is on the patient, and they're just telling me anything and everything that they're dealing with. Because like I said, pelvic floor issues can sometimes be happening in combination with other things like back pain or hip pain. And so then we start talking about all of that. And then while they're talking, in my head, I'm putting all the pieces together, already analyzing what's happening or what could be happening and what I'm going to be testing or looking at. So I have all of that information. Then I have the patient stand up. I'll take a look at their posture. I'll take a look at their breathing, but without letting them know that I'm looking at their breathing. Yeah, and then from there, I'll take a look at their lumbar mobility, so how their back is moving, if they can bend forward, back, side, to the sides, if they're having any pain with that. If they can push up on their toes, looking at their calf strength, because like I mentioned before, with every step that we take, right, we push through our toes, and with time, that can also lead to pelvic floor dysfunction. So, and there's a lot more that goes into that, but I take a look at their calf strength, I take a look at their knees, how they squat, and then from there, I lay them on the table. I assess their hip strength, their flexibility, and take a look at further breathing. From there, I already have a lot of information gathered.
Sure.
Right?
Yeah.
There's also an internal exam for pelvic floor, but that, you have to get the patient's permission to do that. It's not painful at all. And you do it with your finger, and you're assessing for the tension inside of those muscles.
Yeah.
And then based on that response, then you know what muscles need to be. Like I mentioned before, the first phase is to lengthen those muscles. So then you know which muscles to lengthen by doing the internal exam. So after all of that, right, then we go into a little bit of the treatment. If you notice the patient wasn't breathing properly, then you show them breathing techniques to start to relax their body and go that route. Then if you notice there was tension internally, you show them tools, because there's tools, there's wands, there's dilators that the patient can use at home to start relaxing those muscles. But that's something that I would have to teach them how to do.
Sure.
On their own. And then me specifically, I like to lay the patient down on their tummy and relax their back muscles. So I'll give them a massage. And part of that massage is a little bit of scraping and cupping to help start relaxing the body. And so I'll do that for the first 3 sessions. Because like I mentioned before, relaxation is very important for the pelvic floor. And then from there, we just go on phase by phase. So there's 3 phases that I take a patient through, and then we meet their goals.
Wow. And that could take anywhere from 6 to 12 weeks.
Yes, on average.
So if you're this and this is something that you would consider, you're an athlete and you're not doing the sport you love or the activity you love because you're having these issues, this stuff can be fixed within 3 months is a longer phase.
Yes.
So 3 months would be a long time. And if you think about it, 3 months is nothing compared to a lifelong
I was going to say that.
approach of doing the things that you really want to do, taking a holistic approach to fixing this and finding out what's truly wrong. And I hate to say there's something wrong with you, but this is a medical issue that can be fixed. Yes. There's nothing unfixable here. There's nothing embarrassing about this. It is a true issue that can be fixed with proper treatment.
Yeah.
So,
and I would love to help as many women and men as possible, because, people have goals in life. You may want to have another kid. And if you don't fix this now, the problem is just going to get worse. If you're having pain with intercourse, it's going to mess up your relationship.
Right.
And so I want to be able to help people, save their relationships.
Yeah, these things matter. And it's the same thing like from a fitness perspective, when people don't feel their best because they're not moving their best, we want to help them feel better, live their best life. Our goal is to help people become the greatest version of themselves.
Yes.
Right.
I agree.
Through a combination of specialists like yourself and great personal trainers of the world, we can help people do that right here, especially right here in Houston. That's our goal here, is to help Houston make its way up the ladder of health and fitness, right?
Yes.
So is there anything else that you'd like to share about this issue before we kind of wrap this thing up to help people here in Houston?
I would just say that I'm not the only pelvic health therapist. There's a lot of us out there now. And so whatever place in Houston you are or in another state, just search pelvic floor therapists and you should, a therapist should come up.
Yeah. And if you go there, and I'm sure that this is a very professional situation going on. If you go and you get a consultation or whatever you want to call it, and this is not your problem, they would tell them as well, and then they can direct you to a different type of doctor, a different MD or whatever may be necessary for their situation, right?
Yeah, so that's another thing. You have direct access to a PT in Texas now, and so we can evaluate you and treat you for 10 to 15 days, and then we have the knowledge to be able to differentially diagnose between a pelvic floor condition versus something else. And so if it's something else, we would just refer you out.
Yeah, perfect. So guys, if if you have these things going on, don't be embarrassed about it. Go see someone. Quick Google search. Obviously, contact Dr. Chavez here. She can very much help you out. Do you want to share where people can find you, contact you, get a hold of Route to Recovery?
Yeah, so Route to Recovery, we're on Instagram. It's routetorecovery.pt. And we also have our website. It's routetorecoverypt.com.
Perfect. Awesome, guys. Well, thanks so much. Make sure you like, subscribe. We're here to help Houston make its way up the ladder of health and fitness, and with professionals like Dr. Chavez with her knowledge of the pelvic floor and obviously other things as a physical therapist, she can help out with any aches, pains, injuries that you might have. So let's keep moving forward here, and we'll see you guys next time.
Thank you.